Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 3 of our course in evidence-based practice. And once again, a very nice week of discussion. Everybody's been very busy refining your PICO statements. This week, the primary focus was on conducting a literature search. Each of you conducted an interview with the librarian or had a meeting with the librarian where you discussed search strategies that you can use for both your PICO question and your paper here in this class, but also to discuss strategies that you can use ongoing in your professional nursing careers. You will continue to have access to these databases after you leave Sacred Heart University. You'll have access to that library as a former student and an alumnus. And so I know that for myself, I have been accessing these databases for years, and they are just a wealth of information. Once you learn how to use them and appropriately learn how to appropriately find information, they are an invaluable tool, an invaluable resource. It's all about knowledge. And so all the databases in the library are really sort of that vast wealth of knowledge that we've accumulated over the years in nursing research, as well as other disciplines as well. Many of you also have access to these tools through your medical libraries at work or through your workplace, and possibly from other schools that you attended. So most everybody that I've graded so far with the experiential report has found that you found the exercise very helpful, and so that's encouraging. That's excellent. The other focus for this week was taking that PICO question that you had first developed in week 1 and refining it into that pure PICO format. Remember, it's going to be important for this project, for the papers that you write, that you have all 5 components identified. You have to have your population of interest, and that should be pretty specific, rather than saying, for example, just geriatric patients, maybe geriatric patients in a long-term setting, or adolescents in a public school setting or something like that, because you're going to be identifying a setting where you're going to be implementing your practice, and that's really where the focus of your population should be. Your intervention, as I've been saying in class, it really needs to be specific. Think in terms of what are you actually going to be implementing, and avoid general terms of implementing like a new educational program, or implementing a new exercise program. Be specific is exactly what you are going to implement. It doesn't have to be totally spelled out in your PICO, but it needs to be identified in your paper when you actually go to talk about the implementation. So it should give a pretty good idea that anybody can reading your PICO statement would know what you are going to actually be implementing. Your comparison, of course, is going back and just what is the comparison going to be? What are you going to use to compare that intervention with? In many of you, with most of you, it's just going to be whatever your current practice is. You're going to be looking in and tracking data on whatever your current practice is, and then you're going to compare that with the data that you find after you implement your new implementation. And then your outcome, of course, needs to be measurable, specific, observable. Some of you are still saying that you are going to, for example, improve patient care outcomes, or you're wondering what effect a intervention has on patient or staff satisfaction or something like that. Remember, an outcome is a specific outcome that you're looking for. Not just what effect, but what increase or decrease are you going to see in your particular case. And the time frame is, how long are you going to track that data? How long are you going to see how, if you, for example, if your comparison is, what was the data before implementing a new education program, your comparison is whatever your old version of education was, or lack of education. Your intervention is a new education program, so how long are you going to look at that? For most of you, it's going to be somewhere between 3 and 6 months, sometimes shorter, sometimes longer, but it should be a time frame that you're actually going to look at the actual results. Remember, you're not talking about a specific patient here, so it's not, a time frame isn't by the end of the hospital stay. You're looking at the overall outcomes for your particular intervention. That's really the focus here. So I've given some feedback. Please refer to my questions to the instructor and to the places in the discussion this week where I've really clarified that just basic standard PICO statement. Fill in the blanks and you should do okay. See also, for week number 3, the discussion is going to focus on, we're going to shift focus a little bit and have a discussion question related to some general topics related to evidence-based research. We're going to be talking about the differences between a meta-analysis and an integrated review. They're very similar. They're essentially ways where researchers go and they look at the past body of nursing research and then try to come up with some overall conclusions that can be drawn from them. But there are major differences between a meta-analysis, which is more quantitative, and a integrative interview, which is more of a qualitative process. So you'll be discussing that in the discussion question this week. And also the big assignment this week is going to be your evidence-based practice part 1 paper. That's essentially where we're going to take all the information that you've been discussing up until this point in the class and your discussion questions and writing them up in a paper. And this is going to be serve as the foundation for your evidence-based practice implementation proposal that is going to be defined and discussed further in your part 2 paper that we'll be doing in a couple of weeks. So I've answered some questions. One thing that is a little bit confusing about this paper, maybe not confusing or a little bit maddening for a lot of students, is that you have a variety of appendices that are posted in the class. These are appendices that are taken verbatim straight from the Johns Hopkins book that we've been using. The Johns Hopkins book really is the manual here for the process that we're using for identifying the evidence-based practice. One appendix is just a list of what the different levels of evidence are, and it defines what those levels of evidence, because each of these articles that you've identified in your literature search are going to have to be leveled, and you have to sort of identify what level are they at. 2 appendices refer to research articles and non-research articles, and this is going to be where you're going to take your search. And I should clarify, you're going to be only taking 5 pieces of evidence. For this assignment, it's required that you do 5 pieces of evidence, 5 articles, and you're going to be using that as a basis for your evidence-based practice implementation. The idea here is that you have completed your literature search, and most of you have anywhere from 50 to 150 articles that you're going to be sifting through to identify which are the best ones, which are the ones that you really want to do the best work on here. And then you're going to be reporting those in a table of evidence, and that's the last appendix that is listed in the list of appendices from the Johns Hopkins book. So you're going to be writing a paper discussing the background, why it's important, why it's an issue. You're going to be identifying your PICO statement, discussing in a narrative form your search strategy. This is essentially writing a part of your paper that's going to focus on that search. What were the exclusion criteria? What databases were searched? How did you find the articles that you found? And then you're going to be reporting on those 5 articles that you found, reporting them on the table of evidence. And that's going to comprise the bulk of this evidence-based paper, part 1. Then you're going to be completing 5 appraisal tools. You notice that in the real world of evidence-based practice, and certainly in this class, this is a very structured process where you're, taking a structured process to identify a problem and then identify the evidence that goes with that problem, and then distilling that down to the best evidence that tackles the problem. And then you're going to assess each one of these articles to identify how it supports the implementation that you're proposing. And so those are going to be included as an appendix at the end of the paper. For some of you, this is going to be a challenge just because it's cutting and pasting into the paper. I've listed some information in an Ask Your Instructor question. I think it was Christy and Noel had some questions about how do you do this? When I do this, it really changes the format. And there's no real easy answer to that because it depends a lot on your particular computer, how it's configured. If you're using a program such as Perla or an APA editor, something like that, that can make it a little bit more difficult because that you're going to essentially be overriding some of the formatting in those programs when you go and cut and paste this into the paper. But I did leave some feedback on it. They do need to be included as appendices. Remember, appendices always come at the end of the paper after your reference page. So you're going to write your paper, have your reference page, and then you have your appendices after that. Each appendix will be about 2 pages long. The appendices as posted in the class are actually much longer than that, but you're going to be cutting out and only using those part of the appendices that actually pertain to the type of research that you're actually reviewing or the type of evidence that you're actually reviewing. So it's kind of sort of a long video for this week. We're almost at 11 minutes, but in a nutshell, that's really pretty much it. Big task here is the paper this week. For those of you that have already submitted your experiential your librarian interview papers, I've graded the ones that have been posted already in course. You'll see those grades. I've also graded all of the week 2 discussion questions already, kind of on top of it with grading for this course. For those of you who have yet to turn in your librarian paper assignments, remember they're due by midnight of tonight. I'm recording this on Sunday, so they're actually due by midnight tonight. I will be grading those by the end of the week. I anticipate I'll probably have them graded probably by about Wednesday or so. They're relatively easy paper to grade, so the grading time is not nearly as intensive as this as it is for other things. So I anticipate that I should be able to have them all done by about midweek. Again, if you have any questions, please let me know. If you'd like to talk to me, just let me know. I can go ahead and arrange a phone conference, a video conference, or just some other way to help walk you through any of these steps. Remember, and I also encourage you to talk with each other. It's an important part of this whole process. So I hope you all have a great week. I hope that things are nice where you're at. If you have any questions, please let me know, and we'll see you in the discussion forums.